Tonight.
I always felt that I was heavier than most of the kids in my class. I just kept gaining, and I had hit 630 pounds.
An ABC 27 special presentation.
By the time I hit 30, I was about 325 pounds. Food became my addiction. I was just an out-of-shape mess. I was happy, so I thought.
Penn State Hershey Surgical Weight Loss presents The Wait is Over, Exploring Surgical Weight Loss. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. Whether you enjoy a sweet treat or you're on the go and need a fast meal, temptations to eat unhealthy food are everywhere. And according to the Pennsylvania Department of Health and the National Center for Health Statistics, about 29.2% of Pennsylvanians 18 and older are obese. Nationally, roughly 34.9% are obese. For Pennsylvania's children in 7th to 11th grade, 34.1% are either overweight or obese. Tonight, specialists from the Penn State Hershey Surgical Weight Loss are in the ABC 27 call center to answer your questions. Just call the number on the bottom of the screen, or you can email your questions during the show to questions@abc27.com. Dr. Jerome Linsue will answer your emails throughout tonight's show. And remember, all the calls and mails are all confidential. And we begin tonight with Deborah Pinkerton. She'll be sharing a story of one patient's ordeal. Deborah?
Thanks, Chuck. A Schuylkill County woman needed a special scale to record her weight. That's because she weighed more than 600 pounds. This is a huge accomplishment for 47-year-old Bonnie Brown, simply walking outside and feeling comfortable doing it.
It's exciting now that I can go out and people don't point at me and say, well, look how big she is.
For most of Bonnie's life, she had been the center of attention, but for all the wrong reasons. Her weight. It started when she was in grade school.
Everybody made fun of me for being heavy. They used to call me Jiggly Wiggly and Fatso and, all kinds of mean names. And I took it to heart.
By 10th grade, Bonnie had enough of the harassment.
I didn't want to be bullied and called names and stuff anymore, so I quit school.
But Bonnie didn't stop learning. She knew she couldn't control the bullying, but she could control the outcome.
I quit my part-time job and I went back to school at night to get my GED because I felt I owed that to myself to have that education. And I went back and I got my GED, and I was proud of that.
Her perseverance paid off, but Bonnie's weight was a different story.
I would say in my 20s, I would probably gain maybe 15, 20 pounds a month, sometimes more. By the time I hit 25, I couldn't get weighed on a regular scale. And they go up to 350 pounds when I went to my doctor's office, so I couldn't get on that scale anymore.
Food was the culprit, coupled with low self-esteem.
I could, at one point, probably eat 2 burgers and a large fry from like a McDonald's or a Burger King, something like that. I could eat that like nothing and come home in a couple hour and a half, 2 hours maybe, eat more.
Bonnie was frank about the fact that she had been an emotional eater and that at certain points in her life she had had some stressors and would eat in response to that stress.
Bonnie tried to handle the weight the best way she could.
I tried diets, but I would stick to them for a couple weeks and I wouldn't see a whole lot of weight loss, so I would give up. I would think it's not working.
Over the years, the pounds really added up.
I was wearing 10XL men's clothing, jogging pants, anything that was stretched, nothing in jeans and my shirts were the same size, 10XL.
The excessive weight forced Bonnie to quit her job as a school bus driver.
Well, I couldn't drive anymore. I was too heavy to fit behind the steering wheel to steer safely because it rubbed my belly and I had the seat all the way back.
After hitting rock bottom, Bonnie was determined to turn her life around.
I knew it was time. I had to change my life because if I didn't, I wasn't I wasn't going to walk anymore and probably wouldn't have lived much longer.
Bonnie came in here and was an inspiration to all of us. She said that she was really ready to start this program.
When I started my weight loss program, I cried when they weighed me. I had hit 630 pounds. And I knew it was time that, I was going to fight to lose weight.
For 6 months, Bonnie met with dietitians who helped her make significant changes in her eating habits.
We're trying to help them make those lifestyle changes. So they come to us with food journals and exercise records and tell us what they've been doing, and we kind of try to tweak it so that they can maintain their long-term success after surgery.
In the 6 months, I lost 100 pounds on my own, just because I wanted the surgery so bad to help me to be healthy and alive again, because I didn't feel that.
Surgery was the next step.
Well, we both agreed that she would have the sleeve gastrectomy, and it was a slightly technically easier operation to do in somebody with a BMI as high as hers was.
I was excited, but I was nervous because I had never had surgery in my life before that day.
With the sleeve gastrectomy, you do remove about 80% of the stomach, so you're left with a narrow tube of stomach to eat into. You fill up quickly. You have much less hunger with the sleeve.
Bonnie found that to be true.
My 3rd week after surgery, I had lost 50 pounds. I started exercising. The more weight I lost, the more I exercised, the faster it came off, the more consistently it came off. And it just kept going and kept going. Till this day, I'm still losing weight.
She far surpassed anything I could ever have expected with any operation.
Now Bonnie's weight is the center of attention for all the right reasons.
It feels good. I can go out places now and I feel comfortable. I'm proud of myself. I have more confidence in myself. I take better care of myself. I'm a much happier, healthier person.
Bonnie says she never expected to lose this much weight, but says since she is never going back. Now, Bonnie was on medication for high blood pressure and diabetes. Now she no longer has those problems. So certainly some very good news. Chuck, back to you.
That's correct, Deborah, and just a different person when you see that. You walk past her, you wouldn't know her. She seems very, very happy. Joining us now is Bonnie's surgeon, Dr. Ann Rogers. And Doctor, we're talking about the sleeve gastrectomy. How often do you perform this?
If you had asked me 2 months ago what's the most common operation I perform, I would have told you the gastric bypass. But as of 2014, the sleeve is now the most common operation for weight, and it's certainly most of what I do.
Are there advantages, disadvantages of the sleeve versus the gastric bypass?
The sleeve is a slightly technically easier operation to perform. There's no rearrangement of the intestines, so it's actually easier to perform in larger patients. It has some other advantages. It decreases hunger in patients more than other operations do. And it doesn't allow for the dumping syndrome, which is a problem you see more in the gastric bypass.
What do you mean by that? We talked about that earlier.
The dumping syndrome is where food goes directly into the small intestine. Because the stomach that we leave behind has a valve, food goes into the intestine more slowly, and it doesn't cause the kind of symptoms that bypass patients will get.
Well, another procedure that I heard talking about, duodenal switch. What is that? Is that something that you'll be doing at Hershey?
We're going to be offering the duodenal switch procedure this year at Hershey. It incorporates both a sleeve gastrectomy and a distal bypass. So it's something of a combination between the bypass and the sleeve. It's a very malabsorptive operation, so patients can get into trouble with micronutrient deficiencies. Those patients need to be followed very carefully in terms of the vitamins and minerals they take.
At the opening of the show, we quoted about age groups that had certain levels of obesity. Is there an age limit, too young, too old for these kind of surgeries?
Some programs won't accept patients until they're 18, and some programs have a cutoff age of 65 as an upper end. We actually have teenagers in our program, and I think probably the youngest patient we would operate on is around the age of 15. I just did a first-time operation on a lady who was 75 last week. She's a very youthful and spry 75, so we haven't found a reason to have a very high age limit cut off yet.
All right, well, thank you. Right now, we're going to switch back over and check in with Deborah Pinkerton at the ABC 27 call center. Deborah?
Thanks, Chuck. As you can see right now, the phone lines are very busy. I'm told a lot of the questions are, how do I know if I qualify to have surgical weight loss? Once again, that number is 717-346-3333. Now, here to answer some of our viewer questions this evening is Dr. Randy Halleck. Here is the first question you're going to answer for us. Thanks for being with us. My brother-in-law and another friend both had surgery for weight loss. Since then, they both suffer from low iron and need to have iron infusions. Is this a side effect from surgical weight loss?
Well, it's very important for all patients that have had weight loss surgery to monitor nutritional parameters, including vitamins and minerals, and have supplements. But requiring a transfusion or an infusion of iron is very unusual. Patients that are good about follow-up and monitoring these parameters should not ever need something like that.
Okay, thank you, and we will come back to you for more questions. If the phone lines are busy, you can email your question to questions@abc27.com. Stay with us. We will be right back.
You're watching The Wait is Over, Exploring Surgical Weight Loss on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. A Lancaster County man knew it was time to make a drastic change in his life. At 34 years old, he was willing to make the change, but he knew he needed help. Jason Klotzer never expected to be practicing with the Harrisburg Rugby Football Club. But for the past 2 years, he's been doing just that.
Rugby became my addiction, which is a pretty bad addiction to have when you're my age because everybody else is a lot younger, a lot more skilled than I am.
But this is a much healthier addiction. Jason was addicted to food, which got him into trouble.
It didn't matter, I just loved to eat, and I love to eat everything, and I'm pretty sure I ate everything.
Jason's bad eating habits started when he was in his 20s.
I started working, a 9-to-5 job where I would sit at a desk all day and start snacking, eating really good foods, going out to lunch. Fast food became like a necessary addiction.
Jason's once slim figure quickly changed.
And then I get, in the mid-20s and the weight started coming on. I went from 200 pounds to 220 and I was like, oh, I probably gotta lose some weight. And I started to get a little bit of a belly and I was like, And then it was 230 and then it was 240 and then it was 250 and then it was 280 and then it was 300 and it was like, it's not stopping. And the time I hit 30, I was about 325 pounds.
Once active, Jason's added weight slowed him down.
And I go for a walk with my dogs and my feet hurt, my ankles hurt. My feet would hurt so bad I could walk maybe 100 feet and then I have to stop and try to stretch out my arches.
Jason's health became an issue too.
I had sleep apnea, high blood pressure, high cholesterol, pre-diabetic, multitude of just general malaise, just health issues, never felt good.
Jason decided to do something about his weight.
So I started doing Weight Watchers, started going to the gym. And it sounds real, oh, that's the right way to go. And I did it, and I lost like 60 pounds, and I felt great. I actually bought some new clothes. I was still 280 pounds. I was still 80 pounds overweight.
Moving in the right direction until the weight stopped dropping. Instead, Jason gained it back and more.
My highest weight was 397 pounds. And that was in 2009. Wearing size 54 pants.
At the time, Jason became engaged to his childhood friend, Pam. The thought of a wedding forced him to really think about his weight.
I didn't want to look like a gigantic penguin in a tuxedo. I just thought that if I'm going to stand in front of all my friends and family and spend all this money on photographers and videographers, I'm going to look good in a tuxedo, darn it. And that's going to happen.
Jason knew surgery was the only answer, and he was ready to start the process.
You have to lose a certain amount of weight. You've got to go through classes. You've got to see a dietitian, go see a psychologist, make sure that your reasons for doing it are the right reasons.
In his case, he really wanted to change his lifestyle. He had not been exercising. He had not been really working on his eating habits, and that was a big challenge for him.
We tell them that it is up to them, success is in their hands, and they need to make the lifestyle changes. It's not a diet or a quick fix.
Jason was ready for a change.
He ended up having the Roux-Y gastric bypass, and that's the most common operation for weight that anybody does, and that's the operation where you make a small pouch that's separated from the big part of the stomach, and then you attach some intestines to the pouch. So instead of eating into your big stomach, you're eating into the small intestine. Then you have to plug in a new connection so your digestive enzymes will meet with the food. Nothing's removed in the operation, but it's that rearrangement that's why the operation works.
The surgery worked for Jason, and so did his attitude.
I was already at the gym. I was at the gym 15 days after my surgery. I was convinced that there was nothing going to stop me.
Jason had set high goals for his wedding, which was 3 months after the surgery.
My goal was to be at 240 pounds for my wedding. That would have shown 120 pounds gone. So at 100 days after my surgery, I was down 100 pounds, and I looked like a totally different person. The day of my wedding, I weighed 237. I hit my goal. My tux was still too big, and I had 4 fittings. Nothing I could do. I mean, the day was upon us. I looked great in the tux. I was really happy, but I probably could have got a size smaller and been even happier, but I feel like a brand new person. I've done things in the past 3 years I didn't think I'd get to do again.
And Jason continued to lose weight. He now weighs 205. He does say he feels like a brand new person. Chuck?
You can hear that in his voice, too, when he talks. He just feels good about himself. What a remarkable story. Doctor, in both stories now, we saw that the patients are successful at maintaining their weight. Why do some people gain some of the weight back?
I think a small percentage of patients gain their weight back because it just becomes easier to eat. And so if you go back to your old bad habits and making poor food choices, that's the main reason that people will regain weight.
What about, I've actually seen this firsthand, what about when patients get pressure maybe from family or friends? They hear that they're considering this type of surgery and they say, well, that's an easy way out, or boy, there's really wrong things about that. What do you tell them?
People love to tell horror stories about weight loss surgery. I think there's discrimination about obesity, so there's discrimination about weight loss surgery. But the fact is, it's a very safe set of operations now, and people should not be afraid.
Sometimes we hear people say, I'm healthy obese, not necessarily in those words, but they're large people, they feel good, there's no outward sign or anything they can detect. Why would they be candidates for weight loss surgery?
I've seen many websites of people who say that they are healthy obese, and it's discrimination to talk about obesity as a disease. I think many of those patients have their medical problems not yet diagnosed. And even if they don't yet have medical problems, they're very likely to develop them as time goes on. Weight loss surgery, for example, is very good at preventing diabetes in people who have a family history of diabetes. It's good at preventing cancers that may come in the future. So it's effective even for people who are not yet sick.
Okay, well, thank you, Doctor, for joining us here tonight.
Thanks for having us.
And we're going to check back in with Deborah in the ABC 27 call center. Deborah?
Thanks, Chuck. We are here with another viewer question. I had gastric bypass surgery over 4 years ago. Since then, I've lost over 180 pounds and I exercise regularly. Is it possible to have the surgery reversed, since I believe I will continue to keep the weight off?
Well, many patients have had this operation, and they lead normal, healthy lives for many years, even decades after this operation. They exercise normally, they eat normally, they eat healthy, but they eat normally, and there's really not a good reason to have the bypass reversed. Plus, that would mean an operation which is a very big operation and a high risk. There's really not a good reason to have the operation reversed.
Okay, thank you. We'll be back with more viewer questions. Once again, the phone lines are busy this evening. You can email your question during the show to questions@abc27.com, and we will be right back with more viewer questions right after this.
The wait is over. Exploring surgical weight loss on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. You still have a few minutes to get your questions in. I know the phone lines are busy, but the number to call, 717-346-3333. The lines are open until 8 o'clock this evening. Now, we have time for one more viewer question. Dr. Halleck is going to answer that for us. Are there any long-term diseases or side effects to be concerned about from gastric bypass surgery? And will I need to be medically treated differently if I were to get cancer or heart disease?
The answer to that question is no. And in fact, we obviously perform the operation to reduce the risk of long-term diseases, including cancer. Of course, you should let your physician and healthcare provider know that you've had gastric bypass surgery. But patients who have had this operation are treated exactly the same as any other patient. And no, there are no side effects in that area.
Okay, Dr. Halleck, thanks for being here this evening and answering our viewer questions. And we do also want to thank all of the specialists here this evening. Once again, the phone lines are busy. You can try and give them a call or email your questions as well. And we'll send it back to you, Chuck.
Thank you, Deborah. Dr. Eric Pauly and Dr. Jerome Lin Su now join us. And we'll be showing you some video clips of procedures of these doctors as we go along here. Some are a little graphic, but it shows exactly what happens here with the good doctors and what they do on a day-to-day basis. And I'm going to begin with Dr. Lin Su. What's the difference between robotic surgery for weight loss and traditional weight loss surgery?
Well, Chuck, robotic surgery is very similar to the traditional weight loss surgery. We do use the same minimally invasive techniques, very small incisions, keyhole incisions to do the procedure. Same procedures are performed whether it's a gastric bypass or a sleeve gastrectomy. But the main difference is that the surgeon is seated at a console. He or she is performing the surgery while the robot is by the bedside. The robot itself gives us a couple of unique advantages. The image that we get is a full three-dimensional image. We're fully immersed in the operative field. We use very advanced instrumentation to allow us to do very complex maneuvers in very tight, hard-to-reach areas.
Now, is anybody a candidate for this robotic weight loss surgery?
Yes. If you qualify for weight loss surgery, say from a weight standpoint, your body mass index, your comorbidities, whether high blood pressure, diabetes, or a combination, and you're fit for general anesthesia, you are certainly a candidate for robotic surgery.
And Dr. Pauly, complications after bariatric surgery they're fairly uncommon, but how do you manage patients that do have developed problems? What do you do?
Well, fortunately, Chuck, you're right. Complications are uncommon after the procedure. We have a very advanced method of endoscopically managing a lot of these problems. We find patients who have problems with strictures or narrow areas, which we can use balloons to dilate. Even very complex problems can be managed as an outpatient procedure in the majority of patients. And so most people don't require a surgery to fix the problems that occur after the surgery.
And what do you do for patients that have problems with regaining weight after surgery? How do you deal with that?
Yeah, we had a question earlier about weight regain, and it's a problem that we do see. We have a comprehensive program for patients who have had surgery and regained weight. They come and they go through our diet and exercise program, and then I evaluate the patients, and a good percentage of patients who have that problem are actually a candidate for an endoscopic revision, where instead of having a surgery to revise the problems that we find, I actually pass a small camera and a sewing machine down through the mouth, and we use that to plicate parts of the pouch that may have grown in size and are abnormal and can be associated with weight regain.
I think people are surprised to hear you put that down and you work from there.
Yeah, it's a sewing machine that we actually pass.
How much of you personally have to be a cheerleader when someone comes in with a weight gain after this procedure? They look at you and they want you to tell them you can do this.
Well, they can do it. That's the point. I think a lot of people very slowly over the course of time slip back into perhaps bad diet and exercise habits. And so part of the comprehensive program for people who are regaining weight is to get them back in with our dietary and exercise counselors to help them regain and relearn some of the habits that they learned before the original operation.
Okay, well, thank you, Dr. Pauly, Dr. Linsue. Thank you for joining us here tonight. And we also want to thank you, our viewers, for sharing your stories and sending in your many, many questions. If you would like more information or you'd like to schedule an appointment with Penn State Hershey Surgical Weight Loss, all you do is pick up the phone, you call 531-7260, or you can visit online, pennstatehershey.org/SWL. And this Saturday, come out to Hershey Story Museum for free hands-on CPR training from 9:30 in the morning to about 3 in the afternoon. If you want more information on that, you go to pennstatehershey.org/CPR. Thank you all for watching tonight, and as always, we wish you good health.